This video has been produced to demonstrate how to prepare injectable medication from vials and infusion bags. It should be used in conjunction with your local procedures, which should always be followed. First of all, assemble your drug, consumables and required number of labels that you need to make the product. Record information such as batch numbers and expiry dates on the batch documentation in accordance with the local policy, and then familiarise yourself with the method of preparation. Before starting the preparation, you should ensure that you have removed makeup and jewellery and check that you're wearing the correct clothing and gloves for the area that you are working in. You should also clean your gloves. This poster outlines glove cleansing technique. Pause the video now if you need a quick reminder. Next, prepare the working zone. You must only make one batch at a time, so the bench space must be clear of all other items. Spray the disinfectant on the bench and wipe over the entire surface using overlapping strokes. Where possible, work over a tray which has also been cleaned. The next step is to lay out your equipment. Try and do this in the order that you will work in. Check your medication is the correct drug and strength and that it has not expired and is not damaged, so look out for cracks in the glass, discoloration and particles in solution. We have used a coloured solution in this demonstration to make it easier to see the process. Clean the bung of the vial to remove any local contamination which could get into the dose. Once cleaned, do not retouch this area. Whilst you're waiting for the area to dry completely, prepare the syringe and other consumables so they're ready to use. Peel open the wrappers and connect the ends. The key parts that form the connection should not be touched during assembly, and the syringe held far away from these areas. First of all, withdraw the required volume of diluent from the infusion bag. Rest the bag on the surface and hold the port in mid-air. Pierce the additive port in a central position with the needle attached to the syringe, taking care not to puncture or scratch the side of the additive port or bag. Make sure that the needle tip is in the liquid. Remove the diluent by pulling the plunger out, then push the solution and any air bubbles back into the bag. Repeat this until the air is removed and then draw back the syringe plunger until the required volume is in the syringe. Gently squeezing the bag makes it easier to withdraw the volume into the syringe, as it reduces the force and pressure needed to pull back the plunger. Remove the needle and replace it with a luer-to-luer connector. It is important to get the volume of diluent checked at this point. When preparing a dose from a vial using a syringe and needle, the air displacement technique should be used. Draw the plunger up to the required volume of solution that needs to be withdrawn. Push the needle through the bung and invert the vial and syringe. Ensure the tip of the needle is in the solution. Pull down the plunger and withdraw some of the solution in the vial into the syringe. Release the plunger and gently push the plunger back to inject some of the air back into the vial. This ensures that the pressure in the vial stays equal and does not cause the liquid to leak out of the vial. Keep repeating this process until all the air in the syringe has been replaced with drug solution. Check the volume is correct. Turn the vial upright and withdraw the needle from the vial. Then move on to the next vial and continue until the correct volume has been drawn up. In this video, we're going to demonstrate preparing a dose from a vial using a dispensing pin with the second vial. First connect the pin to the syringe. Push the dispensing pin through the bung and invert the vial and syringe. Pull the plunger down. If the solution contains a large amount of air, push the plunger back in and expel liquid and air back into the vial, and then pull the plunger down again until the correct volume of solution has been withdrawn. If significant air remains in the syringe, repeat the process, making sure the dispensing pin is fully immersed in the liquid. If a few small air bubbles remain, these should be insignificant and not impact on the volume. Check the volume is correct, turn the vial upright and detach the syringe from the dispensing pin. A dispensing pin can be used several times, usually a maximum of 5 before it becomes blunt. Next, connect the drug syringe to the diluent syringe. Push the contents back and forth between the syringes up to 10 times before pushing all the solution into the final syringe. Follow your local procedure for the number of times you should exchange the liquid. Thorough mixing is essential to ensure that an even concentration throughout the syringe is obtained. You can see from the photo that without air present, a uniform mix is not achieved, even after inverting the syringe several times, so it is important to introduce a small amount of air into the syringe when mixing. Remove any excess air by tapping the syringe to get the air to the tip, then pull down the plunger to clear any solution from that tip before pushing the plunger up to remove the air. Remove the lure connector once this is completed. Once the connector is removed, cap the syringe. At the end of the preparation process, reconcile the products to make sure you have made the correct amount and can account for all the products. Confirm that the products meet the acceptance criteria. Label the product. Ensure that the product master matches the worksheet and contains the correct expiry date and batch number. Ensure the label does not obscure the graduations so the solution can be confirmed on the ward and the volume can be clearly read. When checking the product meets the acceptance criteria, you should check the correct volume and the correct colour and that it's free from particles, leaks and defects. You have now finished your product.